Hi, everybody. Welcome back. Conversations on a Bench. I'm really excited about the next person joining me. This is Cathy Alderman. Cathy is the Chief Communication and Public Policy Officer at the Colorado Coalition for the Homeless. She's been there for 10 years almost. And she's also a lobbyist for state policy. And I love this. She self-describes herself as a social justice advocate. So welcome. Thank you for joining me on the bench on a beautiful Colorado day.
Yeah. Thanks for having me today.
Yeah, of course. I think it'd be really great just to start off with you just sharing a little bit about the Colorado Coalition, because there may be people that have heard the name but don't know much about it, and you guys do such amazing and important work. So if you can just share with us, give us your spiel.
Sure. So the Colorado Coalition for the Homeless has been around for over 40 years. We are a housing and healthcare provider, so we're a little bit different in the homelessness response system in that we provide those lasting solutions for people. So we own and operate 23 properties of supportive and affordable housing, including some transitional housing programs. And then we're also a federally qualified health center. So we provide the full range of integrated healthcare, including primary care, behavioral health, substance use treatment, vision, dental. We have a pharmacy on site, and we do that through clinic sites, including Stout Street Health Center, which is downtown. And then we have a mobile unit that goes out to some of our shelter facilities and the micro communities. And we also have a street medicine team that goes out and just meets people right on the streets, right where they are, to deliver health care. We also do supportive services. So we have a family support program, veteran support program. We have a child care facility for lower income households that are in supportive housing. And really we've, I think over the years, just tried to fill the gaps, right? We find a gap and we find a way to fill it. So for instance, several years ago, we opened up a recuperative care facility because we were hearing from hospitals that they were being forced to discharge people into homelessness who couldn't recover on the streets. So we opened up a recuperative care facility in partnership with our local hospitals. And we also now operate 2 transitional housing programs for people experiencing homelessness with substance use disorders. We've started that program 12 years ago at Fort Lyon, and then just opened last week up at Sage Ridge.
Wow. Okay, so obviously you've given that speech before, because that was really good. But it never ceases to amaze me how much you do and the important role that you guys fill. And I was talking to you off camera and mentioning that earlier today we had Donna, who is the president of Denver Health here, and she was mentioning the FQHC, and we were talking about just the importance of people that are experiencing homelessness being able to get health care, not only when they need it, but also where they need it. So can you talk a little bit about how important that is to have clinics that your residents can access easily?
Yeah, absolutely. So, I mean, we believe that housing is healthcare, and that healthcare is so critical to being successful in housing. And so we also operate on a very low barrier model. We want to make sure that when people come to see us, they get all the services that they need in one place, right? They don't have to make multiple appointments. They don't have to go to a separate pharmacy. But we learned over the years that anytime we can take healthcare to people experiencing homelessness, especially on the streets or in shelters, it's going to be better for them, and we're going to build that relationship so that long term we can serve those healthcare needs for those clients. During COVID, we really learned the benefits of co-locating our clinical services on site in partnership with our shelters. Because we were doing, in COVID times, we were doing the screening and the isolation, and then ultimately the vaccinations. And it was just such a benefit to have those services right there on site. One of the things I'm always really excited to tell people about is how we bring dental services to people experiencing homelessness, because so many people go without dental care, you know, for months on end sometimes, because it's just a lower priority in terms of what other needs they're addressing. And so we take our mobile unit, which has 2 exam rooms, out to different sites and provide dental care, just basic cleanings, and then sometimes we can refer people for, you know, higher levels of care. But we've had so many people tell us what a huge difference that makes in their overall health. And so I think anytime that we can you just reduce those barriers, just get people access to the services they need, it gives them both it makes them healthier, but it also gives people a sense of being part of something, being taken care of, being seen.
Yeah.
And all of those things are so important for people experiencing homelessness. And so I think it's just part of our model, and it does make us unique. And it also has really helped us with our supportive services model, because we have so many clinicians already on staff that can help with those behavioral health services and substance use treatment services.
Yeah, that's so good. Somebody shared a story with me almost a year ago now about there was a gentleman who was unhoused, unsheltered, and outreach teams would reach out to him, and always the same thing, right? Offer him going into shelter or whatever, and it would usually always be a no. And there was a medical street outreach team that came across him, and they said, well, is there anything else? And he said something about his foot. And they said, well, can we take a look at that for you? And they took a look at his foot, and it was from frostbite. It was like he was going to lose his foot. He was going to lose the entire foot, like gangrene, that kind of stuff. And that street outreach team was able to not just start caring for him there, but then they built that relationship and that trust, and they were able to get him that night to leave, obviously go to the hospital and get the care that he really needed, but then to not go back to homelessness, right? And that is what's so important about what we all do, but what you guys do with the street medical team.
Yeah, absolutely. We see a lot of people who have given up on finding solutions to their homelessness because they've been cut out of so many systems, or they've been rejected, or they've been told no. And so they have resolved themselves to sleeping outside, maybe in perpetuity.
Right.
And when our street medicine and our clinicians on the street meet with them, it's that first contact may not be the time where they suddenly say, oh, I trust you and I want to get services from you. But that third contact or that fifth contact where they say, you keep coming back and you keep providing for my survival needs and taking care of me, remembering my name, bringing me socks, then eventually they know that they can count on us.
Right.
And I mean, the clinicians that we have working for us are the most caring people in the world. And so then they might come into Stout Street Health Center or one of our other clinic sites. And then once they're in there, we can start working with them on access to benefits if they're not ready to take that housing journey.
Right.
But eventually we can then start working with them on that housing journey, because they do trust us and they see that there's a system in place that will help them.
Yeah, a system in place that will help them, and people working in that system that, to your point, care about them and know them, right? We all want to be known, valued, and loved. And it's not any different if you're unhoused. And we have to, one of my mentors in this work once said to me, we earn the right. Right? We earn the right. And a lot of people might not understand that, but it's true. We have to earn the right to provide the services that we know will help. And, when you're talking earlier about recuperative care, like sometimes I think people that don't work in this space, they're like, well, why is that important? But imagine you went to the hospital, you had to have surgery, you're in the hospital for a couple of days, and they discharge you and say, okay, we're going to have a visiting nurse, who's at home, your spouse is at home, or your partner. Okay, great, they need to do this for you. And that's how you recuperate. And what happens when you don't have any of that? You don't have the house, you don't have somebody to help you, there's no address for the visiting nurse to go to, right? And that is so important, because what would happen to that person? Either the hospital has to keep them, which isn't a good answer, or they get discharged back to the streets, which is a terrible answer.
And we know what happens to them. If they go to shelters are not equipped to deal with these high medical needs, or they end up back in the emergency room. Yeah. And then that cycles over and over and over. And that's not good for individuals. It's not good for our healthcare system, and it's not good for taxpayers.
That's right.
So, having this recuperative care is far less expensive than it is to let somebody have to go to the emergency room, to recover. Yeah.
And that's such a great point that you make, right? Is if one of my children, they're hopefully too old to do this now, but they fall and break their arm and I have to take them into the emergency room. Well, what would I like? I would like them to be able to be seen in a timely manner. But if we have people that are there that shouldn't be there taking those beds, that has that snowball effect on the entire system and all of us. Yeah. So it's in our best interest to be thoughtful, preventative, and to do these things that might seem out of the box, but in some ways I think they're common sense.
Yeah, and we've proven it in Denver because housing somebody and providing them with supportive services or using short-term recuperative care as a bridge to a longer-term housing option is far less expensive than it is to let somebody cycle through our emergency systems.
Yeah.
In fact, it only costs half as much to house somebody with supportive services than it does to leave them outside to cycle through our emergency services, including emergency rooms and detox and shelters. And so I think, as we think about solutions, we need to think about solutions that are better for people, better for communities, but ultimately are also far more cost effective for society at large.
And I wish there was like a magic wand that I could wave that would get everyone to understand that by doing this, it actually will save money and help people, right? So that's a win-win.
Absolutely.
There's probably more than two wins there, but it's definitely a win-win, right?
I tell people all the time, if there was a way for us to think about our budget, whether it's the Denver city budget, the state budget, the federal budget, if we could budget in cost savings instead of just having to count dollars in the bank, we could go a lot further with the policies and programs that we know work.
Yeah, you're exactly right. So let's talk about housing. How many, you said 23 sites, how many units of housing is that?
We have just under 2,000 units,
Wow.
but that does include our transitional programs. And then we also, on behalf of the state and the city of Denver, we administer housing vouchers for about another 2,000 households.
Yep.
So we're housing between 400 and 4,500 people on any given night across the state of Colorado.
Wow, that's amazing. So here's a question. Sometimes people will say to me, they'll start talking about housing, and they'll say, well, I'm hearing it's not a housing problem, that housing is down the road, it's not now. So what would you say to that?
Well, homelessness is absolutely a housing problem.
I knew you were going to say
that.
Yes.
It makes me feel like lost in space when I hear people talking about homelessness and not talking about housing, or talking about housing and not talking about homelessness, because it is in the same spectrum. It is the same problem. And it is, homelessness is absolutely a housing affordability problem, especially in places like Denver and the state of Colorado. We are the 10th least affordable state in the country when it comes to housing. We have a very high cost housing market. And frankly, we've made some investments at the state level and at the local level too, but what we're not investing in is that deeply affordable housing for people exiting the cycle of homelessness, or for those lowest income households. And so those individuals are either living outside, staying in shelters much longer than they should, or they're what we refer to as renting up. So they're spending more than 30%, sometimes more than 50% of their income on rent, which creates a lot of housing instability, meaning that month over month, they might lose their housing in a minute. And what's difficult about that is once you lose your housing and you enter the cycle of homelessness, the longer you're in it, the harder it is to get out.
Yeah,
right?
And the more expensive.
Absolutely.
Yeah.
And so, to the extent that we can keep people who are currently housed, that's great. And we see a lot of homeless prevention programs, rental assistance and eviction prevention programs. But those, unfortunately, aren't very sustainable or very well funded. And so we're not investing in the deeply affordable housing that we need. We're not able to help people stay housed. And so then we wonder, some people wonder why we continue to see homelessness increase. And it's because we're not making
cause and effect.
We're not making the housing investments that we need.
Yeah, I completely agree. And I think, I've been in this space for 14 years now, almost 2 now in Denver. But I continue to look at the population that we serve. So last year we served over 11,000 unique individuals. And, I look at the population that we serve and I say, okay, so many of the people that are coming into our shelter don't need shelter, and they will do fine if we can get them, to your point, if we invest deeply into the truly affordable housing, they will do fine. Sure, support services, which are extremely important, I think we should always offer those, but they will do fine, and actually they're doing less than fine by living in a shelter for 1 year, 5 year, 15 years, however long it might be. But the other side of that coin also then is when you look at the people that are accessing the shelter system that truly do need a lot of help, right? They have physical or mental deficits and challenges that are just devastating and overwhelming. How many resources are we spending on people that if we could just house them, that would free up our resources to help the people that are the toughest and the hardest to help, because my staff know this. I say this all the time. I walk through our shelters and I see, I'm picturing a guy right now who he's in a wheelchair. He's lost both legs. He's suffering with some PTSD, a lot of PTSD, and over he's in our shelter. And that breaks my heart because no one should die on the streets, right? Nobody should die even in a homeless shelter, right? We should be robust enough in our system to be able to say that, I'll use the words that you and I know well, right? It has to be brief and non-recurring. And I think by not investing in solutions that we know that will work, it feels like the snowball just continues to get bigger.
Yeah, absolutely.
I guess I'm preaching to the choir.
Yeah, no, but you raised a couple things that I think about. We, after we opened recuperative care, recognizing that as a huge gap, we have talked seriously about what does it mean to provide end-of-life care to people experiencing homelessness.
Yeah.
Why do they not deserve to die with dignity like the rest of the housed population? And so can we provide some low barrier, hospice care where we know that person is at the end of their life, but they should be indoors and they should be getting services and they should be supported. They shouldn't, be in a congregate space or on the streets. And so we're looking at that model because as we're seeing an aging population among people experiencing homelessness, this is a reality. And it's a sad reality.
It is a sad reality.
And it's heavy, but it's a problem that we can solve. And then I also think a lot about how we're using shelter. Shelter was always intended to be an emergency solution.
That's right.
It should be available, right, for everybody when they need it, you know, in those emergency moments. But unfortunately, as a community, we have let shelter become the solution because we're not investing in housing. And so people are staying in shelter far longer than ever intended. And that means that shelter is not available for all of the people who do find themselves in the emergency of homelessness. And so, you know, I think it's just, we've just done it a little upside down, unfortunately.
And I think that, you know, the hope is that we know what will work, right? The hard work is getting the whole community's support and buy-in to do what will work. I was reminded of another story when you were just talking about hospice, and you know, a lot of people don't know that right across the street here at our Crossing campus, we have a partnership with a hospice organization, and we have people that are terminal, that are experiencing homelessness, and they're receiving their end-of-life care there, and it humbles me. And in my career, there was a shelter guest who everyone knew, and he was diagnosed with stage 4 cancer, and it was terminal. And, you know, we were trying to find a place for him to go, and he looked at us and he literally said, "This is where I want to die." And we said, "Why?" And he said, "Because the people here love me." And it broke my heart in two ways. In one way, it broke my heart because he shouldn't have had to die in a shelter. And on the other hand, it broke my heart because at least he felt loved and known and valued. But it also gave me energy to say, this isn't right. We have to work against it. This story can't become the norm, right?
No, it's always difficult every year. About this time is when we start collecting names for our annual vigil, which we hold on December 21st every year. It's the longest night of the year, and we honor all of the people that were experiencing homelessness and have passed away in the prior year. And the stories that we hear, like that one, you know, are crushing. It just tells me, I hear your double heartbreak, right? Because so grateful that he felt that way about the people who were around him and supported him, and so awful that he didn't get to die in a home, in his own home,
with the dignity and support that we would want, right, for us or our loved ones. Yeah, absolutely. So from your perspective, your experience, how can our community rally around and become better as a community because, I've been saying it, I think every session, I believe homelessness is solvable. So what does our community need to do to really start moving the needle in the right direction?
Yeah, it's a good question. So another thing that we do at the coalition is we do a lot of advocacy work and public education work, and that's actually what my department does primarily. And so I think there's a couple of things. I think having these kinds of conversations is really important. I think that educating the public around issues related to homelessness so that it's not just the guy that they see on the streets, but they start to understand the systemic issues that have led us to the place that we are, and that there are solutions to those systemic issues. It does require a lot of political will, which you have to build. But then I also think, kind of as a community, because we're in this like crisis prevention, intervention mode all the time, we don't stop and celebrate our wins very often. I mean, we're housing 4,000 people tonight. We don't talk about those people because they're not visible. But they're housed, they're getting ready to cook dinner or, pick their kids up from soccer. I mean, they're like, they have completed the journey out of homelessness into stable housing, and we just don't talk about them because they no longer feel like a problem to society. So I think that's why I think the education is so important, and finding ways to celebrate the wins that we do have in this space, despite the fact that we're constantly churning to solve what feels like an everlasting problem, and sometimes an intractable problem. But I believe it is also solvable with the right resources and the right political will.
Absolutely. Well, I can't believe I'm looking at our time is already up. Cathy, thank you so much. Thanks for all the work that you do. Thanks for the ways our organizations partner together. And thanks for joining me on the bench.
Yeah, absolutely. It's been my pleasure.
Great, thanks. And we will be back next with one of our friends from the state of Colorado.